and that's a whole discussion of itself, but the bottom line is I want you to remember that substance-induced disorders are important to look at because too many mental health professionals and psychiatrists have not been trained well in addiction, do not take seriously or look at substance-induced disorders, and name too many signs and symptoms what looks like a mental disorder, calling that a mental disorder when it really may be substance-induced disorder, or maybe just emotional, behavioral, cognitive issues of a substance use disorder. And then you have to make sure that the disorder is not occurring delirium. So if somebody's in the DTs and they're psychotic, that has to do with their withdrawal from alcohol, not a separate independent mental disorder. And then, of course, it has to be clinically significant and cause impairment. So if you're going to document, this would be an example. You might have alcohol use disorder with the specifier of severe because they have 6 or more of the 11. It could be alcohol intoxication with a use disorder, a severe use disorder, so they're intoxicated. Some people may be intoxicated, but they don't have a substance use disorder. It could be alcohol withdrawal, and now you have a specifier to be a bit more clear with perceptual difficulties. Or maybe some other alcohol-induced disorder, or it might be an unspecified alcohol-related disorder. So it doesn't quite meet criteria for alcohol use disorder, but it's related to an alcohol use problem. Just to end with, we have in the chapter that now is combined substance-related and addictive disorders, gambling disorder, which used to be in a separate section before, but because we now understand addiction as a brain disorder, which is not just based on using substances, but also addictive behaviors. And the one that has the most research on it, that has been well established, is gambling disorder, and you can read the criteria through. There's 9 criteria for gambling disorder versus 11 for substance use disorder, and different severity indicators as well. Mild for gambling disorder is 4 to 5, moderate 6 to 7, and severe 8 to 9. So the gambling disorder is the one process, if you like, addiction disorder that's in the chapter, but internet gaming disorder is one that will be further studied. And there is not, though, in Section 3, sexual